17 minutes before the hour, and Health Monday, sponsored by Marble City Pharmacy here in Sylacauga. And registered pharmacist Jacob and Jerry Johnson joined us this morning. Gentlemen, good morning to you.
Good morning. Happy New Year.
Well, Happy New Year. I see y'all are able to make it through the blizzard of 2017.
We made it.
Yes, survived.
Yeah. Before we go any further, I saw this somewhere just a few days ago that flu was running rampant. And, I get confused on this about, is it too late for people to take flu shots and stuff like that? Or?
It's not too late. In fact, and this may be old at this point, but about a week ago, Alabama was one of 4 states with pretty high flu activity around the country. And so we're starting to see more and more in the pharmacy as traditionally January and February are the most common months for the flu in the last 30 or 40 years. So it's going to get worse, but it's not too late to get vaccinated. In fact, up until March or so, it's not too late to get vaccinated.
They can get that at the store, right?
Absolutely.
Okay.
We'll be more than happy. No appointment necessary.
All right. Do you give the shots?
So it just depends on whose turn it is.
We're talking about this morning something that maybe a lot of people are not that familiar with, and but the month of January is Thyroid Awareness Month. And guys, exactly what's this about?
Well, again, you're right. This is not, everybody knows there's a heart awareness month or a diabetes awareness month, especially breast cancer awareness month. There's a thyroid awareness month. Everybody has a month now. But, it sounds so mundane compared to the rest. Thyroid disease, however, is more common than heart disease or diabetes. And so this is something that we need to get some awareness out there about. And so I'm glad that we have this opportunity this morning to talk a little bit about it.
What is thyroid and what purpose does it serve?
Well, we all got a thyroid gland. It's kind of located down here below your Adam's apple. I may be pointing to the wrong place, but it's right in there. And your thyroid gland releases thyroid hormone. But the thyroid hormone is extremely important. Even though the thyroid gland is very small, this thyroid gland controls a lot of your body's functions, including functions in your brain and your heart. And so it's something that we don't talk about much, but it's something that is vital to our body functioning properly.
Does all of us have thyroid gland?
We all got a thyroid gland. We all produce and use thyroid hormone. Unfortunately, a good percentage of us have some form of disorder. The most common would be to produce low levels of thyroid hormone. There are situations where you produce too much, but the most common is you produce too little, which leads to fatigue, hair loss, and then what people complain about.
Hair loss?
Yeah, look at you. What people complain about most is weight gain. That's a
Don't
big
look
one.
over at me.
That's a big one. People come in, hey, I'm gaining weight, and I'm eating less. I'm not hungry. I'm gaining weight. I'm tired all the time. My hair's falling out. That's low thyroid, a very often percentage of the time.
Well, January is National Thyroid Awareness Month, and Jared, talk a little bit more in depth about this and what we're trying to get across to people in the month of January.
Sure. Well, as Jacob said, he described some things that are very common. Some people are fatigued, weight gain. I mean, we get a lot of complaints about those anyway. However, sometimes people who have low thyroid are constipated. Basically what happens is the thyroid hormone allows your metabolism and other body function to function properly. If your thyroid hormone level is high, then it almost kind of revs up your body, almost kind of like a car engine or something like that. So it revs up your body's functions, your metabolism becomes hyper, anyway, it's revved up. And so if your thyroid is too high, you may find yourself losing weight, even though you're eating like a hog. And you may find your body temperature being real high. If your thyroid's low, like Jacob said, the fatigue, you may be sensitive to cold, constipation, those kind of things. So when you approach the physician with those type of complaints, one of the first things that they're going to check as they do your blood work is your thyroid gland. There are a couple of different tests that they look at to determine whether you do have a low functioning thyroid.
Jacob, as we talked about at the top, this is not something that everybody just goes to the coffee shop and talks about every morning.
How's your thyroid?
You know, and I'm one of those. I'm not really up to date on this, but if you got an issue with this, I'm assuming. I mean, you got something you got to deal with here.
You do. If you leave it alone long enough, keep in mind, like Jared mentioned, thyroid hormone is basically the engine or the gasoline that makes your heart, your brain, your kidneys, your liver function. And so you can't just leave it unchecked or your health will decline rapidly to the point that it's way beyond noticeable. You're having some serious issues. And so, you know, the typical course is you start feeling these things. That can be anything. You know, what all can make you tired? What all can make you gain weight? I can think of a million. What all can make you cold? What all, you know? So they're very non-specific symptoms, but when you start having them all together, you get to feeling terrible. You go to your doctor, he tests it. Fortunately, it's a simple blood test. It requires nothing from you. And then the treatment is so amazingly simple. It's pills, it's medication. We're not, you know, unless there's an underlying issue, we're not talking major surgery, we're not talking major expensive, painful procedures or years of therapy. We're talking a very easily controllable disease. It's just not a lot of people know about it.
Who, Jared, can this affect? I mean, what sect of people?
Yeah, sure. Well, first of all, there's somewhere around, it's estimated by the American College of Endocrinology that there is somewhere around 30 million people in the United States with low thyroid, usually called hypothyroidism. And they say about half of those people are undiagnosed. So you could just imagine 15 million people undiagnosed, got these problems, need to get it figured out. As far as who gets it, first of all, thyroid disease or low thyroid is very common in persons with a first degree relative that has low thyroid. First degree relative just means your mom, dad, or your siblings, right? So if this is common in your parents, it would be common in you. There are some medications, although those are much less common causes that could cause your thyroid to be low. And then there are certain autoimmune diseases. Autoimmune, just a fancy word that says your own body is attacking itself. And so there's actually a condition, I like to say this because it makes me sound smart, called Hashimoto's thyroiditis.
He said that right. That's correct.
Okay.
Yeah.
Say it fast 10 times.
In Hashimoto's thyroiditis, your body is literally attacking itself, causing your thyroid gland to produce less thyroid. And so there are a number of causes there. I do want to say this is something Jacob said. It is a simple blood test to diagnose this. However, there is some confusion surrounding the blood test. There are actually two different blood tests that they will look at. One of them is called the TSH, thyroid stimulating hormone. Not to get too technical about that, but when a person's TSH tells your thyroid hormone, hey, you need to produce more thyroid. If your TSH level is high, that means the level of thyroid in your body is too low. And so there's an inverse relationship between the test and how much thyroid that you have. That's confusing. I had a patient ask me literally just last week, I went to the doctor, my blood work was high, and they raised my dose. Or I went to the doctor and my blood level was low, but they lowered my dose. It doesn't make any sense, but there's an inverse relationship there. They also might sometimes measure the level, the actual level of thyroid in your blood. Well, that if it's low means you need more. That if it's high means you need less. So there's two different tests. One of them has an inverse relationship, can kind of be confusing. Be sure and clarify that with your physician or your pharmacist.
Black, white, young, old? Is it
Yes.
Okay.
It's more common in women than men because of Jared mentioned the autoimmune aspect to it. That's much more common in women than men. But outside of that, no, it's everybody.
You talked about medication is key, and the medication is available through Marble City Pharmacy, of course. But you know, if people don't know, and this is why we're talking about this morning, thyroid awareness, I don't know, can you replace a thyroid?
With another thyroid? I have no idea. I'm thinking no.
Really, people think, well, you can replace everything almost, but taking care of your current thyroid seems to be key.
Well, there would be no need to replace a thyroid. There's a lot of people. Cancers, that thyroid comes out. Cancers in nearby areas require radiation to the area. That kills that thyroid. You don't replace the thyroid. Again, what you need the thyroid for is to produce thyroid hormone and release thyroid hormone, and that's the pill you're taking is thyroid hormone.
Is this an insurance-related thing as far as coverage of insurance on this type of medication?
Oh, yeah.
Yeah, no problem, no question. This is more common than diabetes. This medication is more common than you could possibly imagine out there. Half the people you pass, it seems like, are taking it on the street. And so, this is not an uncommon condition, not an uncommon drug. I've never had an insurance not cover thyroid medications.
Thyroid Awareness Month in the month of January. Jared and Jacob from Marble City Pharmacy, our guests this morning, and here on Health Monday. It's always the second Monday of the month, and these guys are like clockwork. They're here. And always have a timely topic. And you say, well, thyroid, obviously the thyroid drives a lot of things in our body. And if that goes south on us, certainly we need to get it seen about. You talk about the tiredness and the weight gain or weight loss, that can be a lot of different reasons, but we've got to begin the elimination process somewhere.
Oh, sure, that's right. And that's why we start with the blood work. Let me say this about one thing we were talking about a minute ago. We have hundreds and hundreds and hundreds of patients on thyroid replacement medicine. I didn't look at the numbers. I wouldn't be surprised if it's 1,000 or more patients just at our pharmacy on these type medicines. And so I want to get this out there for sure. And we try to teach our patients this. Your thyroid medication has to be taken in the morning on an empty stomach with no other medications, roughly an hour or so before you take everything else. There are a number of medications and certain products that you might eat or drink that can affect your body's absorption of the drug. And so just a word for all of you guys out there, if you're on thyroid medicine, you're not taking it on an empty stomach, make sure you change to that so you get the maximum benefit out of the medication.
We shift gears for the final couple of moments here on the show. You mentioned taking the thyroid medication on an empty stomach. Well, a lot of people are on multiple medications for multiple challenges in their life and health issues. How important is it that we take this medication properly and, as you say, following the instructions? And we've got so much medicine that we take. Well, you take a handful here and a handful of there. How do you keep all of that organized, especially as we grow older in life?
That's a great question. Here's why. We talked about this one. Take in the morning on an empty stomach. Take with food. Take at night. Take in between meals. Take right before you eat. There's a lot of drugs that are very specific to exactly what time you take them in terms of times a day, what time you take them in relation to when you eat, how many times a day you take them. And you get over a certain age, you get a certain number of medications, and what we're going to call your drug regimen becomes very complex. Boy, I sure wish I knew somebody out there who was an expert at how to deal with drug regimens.
Sounds like you need a pharmacist.
All right.
Talk to your pharmacist. And honestly, get really busy during the day. You'll put your label out there. It'll tell you how to take it, but we don't often get the time to sit and say, okay, show me all your medications. I'm going to take this one at 7, eat breakfast at 8, take this one at 8. We can do that, but to start that conversation, a lot of times you have to ask.
Sure,
we're not going to remember all the
yeah.
time. Hey, I need to stop that guy who takes 20 and sit down with him for 20 minutes and really bring that up. Let's get together. Let's figure out a time. We'll sit in our private room.
Right.
Show us all everything you take. Okay, we need to work out a regimen for you. This is going to be complicated.
And you want to do that.
Yeah,
you don't
write it down.
just guessing at it.
Absolutely.
Yeah.
Absolutely. So I sure wish I knew a drug expert. Talk to your pharmacist.
Yeah. Marble City Pharmacy has grown just phenomenally since its inception. What do you attribute the growth? I mean, you've got untold numbers of patients that count on you guys every day, and we've had these winter issues and stuff, and that kind of gets people out of whack a little bit. You're going to be flooded with people today. What do you attribute the success of Marble City Pharmacy?
Well, it started with Dad and Mr. James when they opened the pharmacy in 2003. I believe, and this is what I tell people, I think what sets us apart is just the experience when you're in there and the way that we treat people and the relationships that we have with them. It's not rocket science. We tell our employees sometimes, it's not rocket science. You take care of a person, you're generally concerned about them and their health, and they want to come back. You give them quality information that's accurate. When you don't know the answer to something, you say, I don't know. That's it. It's not rocket science.
It's a Monday morning, the 9th day of January. Weather has created issues for people. They're wanting to get their medications refilled or filled. On a Monday, especially like a Monday like today, is it better for them to come in later or call, or what's the process on a scenario like this today? Because people, I guarantee you, people are watching this morning and they say, I've got to get my medicine filled, I've got to get it refilled, but I don't want to stand in line. I call, the line's busy. What's the best process on a morning like this?
Wow. Dumb luck. Nah, I was going to say that's how the pharmacy was so successful. Honestly, if it's refills, you try to call. If the line's busy, we're fancy. We have an app. There's an app for that.
Okay.
We have a Marble City Pharmacy app. They can send their refills in over. Again, they can always come in and wait. We try to be extremely quick with that. We try not to have anybody waiting more than just a handful of minutes. If you can't get to us on the phone, you can always come to see us. Again, there's an app. There's a lot of ways to get to us. If you're asking the best way on a busy day like today, I don't know that there's one way than another.
Mid-afternoon, though, if you want to avoid the rush. It'll be wild this morning.
Because all of us coming this morning.
That's right.
Yeah. They've been waiting for 3 days.
There you go. There you go. Thank you guys for being with us this morning.
Thanks
See you
a lot.
again in a few weeks, okay?
All right.
Help Monday with Jared and Jacob from Marble City Pharmacy. We'll be back with more Daybreak right after this.